Hey, podcast listening people, I have a real treat for you today with a guest interview. Make sure you jump on in here. We're live on all your favorite podcast apps, on Facebook, on YouTube, and on LinkedIn. And you can check out B2B Mentors on iTunes. And again, if you want to check out the audio, you can find it on all your favorite apps. Make sure to drop a like minimally. If we bring you some value, which I know we will, drop a like on this video, drop some comments, questions, and make sure to share this. I guarantee you there's somebody else in your network who will get great value out of today's guest. So with that, I'd like to introduce you to my friend Joseph Kim, Chief Marketing Officer at ProofPilot, 23 years of pharmaceutical research, as well as top 100 individuals on the 2015 Medicine Makers Power List, which is a long title to spit out, but important. And top 20 innovators changing the face of the clinical trials industry, which I'm excited to talk about some of that as well. Welcome, my friend. Good to see you.
Connor, it's really great to be here. Thanks for having me. I can't wait to talk about all things research and marketing. It's a really cool mashup. I'm excited about it.
I know you've got like a very interesting background. You should definitely share a little bit about that, because I don't think a lot of people who went down the initial career path that you did ended up in like marketing leadership, role
Right.
and everything. So what got you initially into the world that you did?
My background is in molecular biology. I was also a high school science teacher for a little bit, and I finished my MBA in 2009. So a little bit of everything, but for the last 23 years, I was focused on, gold standard medical grade drug research, which, for a lot of people, it's a really egg-headed thing and, tough, very mysterious, very ivory tower, very expensive, which is sort of the thing I want to highlight. But also over-indexing on just prescription drugs, which is important. Like, don't get me wrong. I think medicine has been a huge factor in increasing longevity and overall public health, for sure. What's also true is that there's a lot of other things one can do to optimize your health that have nothing to do with prescription drugs, right? And that market is exploding right now with regard to health and wellness, supplements, functional food, medical devices, behaviors, sleep, right? All these things are really important. And, those products range from anything from like snake oil, let's be honest, to things that actually a doctor should be prescribing, and everything in between. So after spending a lot of time in research, there's plenty of smart people there. They don't need that kind of help from me, for sure. So I pivoted and joined this company called ProofPilot, which is basically a software that helps anyone to do research. And we're positioning it for the health and wellness community as a research marketing channel, which is very different from market research. So I want to make that clear, right? So market research is the work you do to understand the market. Research marketing, which is kind of a play on words, is using research as the marketing channel. And I'll get into sort of more reasons why that's an important thing today. But that's sort of the long way around of going through science and hardcore research and then ending up in this marketing role, because the research is the marketing channel. And to do that effectively, you just can't be rolling off the couch as a marketer, but you also just can't be sort of a rigid scientist trying to force everyone into science, so to speak. So you need that both of those orientations at play.
There's a lot of supplements on the market, and we're moving much more into back towards traditional remedies, but creating more of a mixture of products that leverage more traditional remedies. It seems like the modern medicine world, I think we're a lot of companies who may be considering developing like a drug that a doctor would prescribe, may do something a little more traditional and go through your process and sell it more directly to consumers, which is really interesting. Do you how do you feel about that? The kind of the modern medicine take versus like traditional medicine. What's kind of your perspective on where we're going with all of that?
Well, yeah, so very, 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 both very important. So, full disclosure, I have something called normal tension glaucoma. That's when the eye pressure in my eye is within quote unquote a normal range, but I'm losing field of vision. Now I can see perfectly fine. What I'm not going to do is just go eat a bunch of carrots. You know what I mean? Like there are good medicines out there that help reduce that eye pressure even more, so that I can save my vision what I have, which is still really good. So I believe in that, and the research to prove that that works effectively and is safe is important. So full stop, that is important and critical medicine. At the same time, if you think about something as simple as eating lots of good foods with high omega-3s, right? That's not a medicine. It's food as medicine, right? It doesn't mean you shouldn't, fairly test it to some degree, but it also doesn't mean you should just ignore it because it hasn't been tested, right? So you have these really good ideas that either have, a long history of effectiveness, let's say, but hasn't been rigorously tested. Or let's take something a little bit more, product oriented, like a green powder, right? Athletic Greens or Beyond Green. There's like 5 or 6, green powders out there that people will use. I drink one every morning. I've tried both Athletic Greens and Beyond Greens. I would love to see a little bit of evidence behind those products, not just saying it's going to help you do X, Y, and Z, and then listing the ingredients. Like that's a start, but consumers today, there's 2 things that's true about them. They're way smarter, and they also have a higher level of distrust, right?
Mm-hmm.
People now mistrust politicians, sports, science even. And so with the explosion of health and wellness remedies that may be great, that haven't been tested, coupled with a high mistrust in the public, and that they're more sophisticated and can do a lot more research on their own, you want to have a way where you can invite your existing customers or future customers to participate in this research, to learn about themselves and to learn about the product and how good it is.
Yeah, a lot of unpack. What do you feel has been most applicable in your unique background to just the bigger picture of doing marketing for a business or for a company? Going into ProofPilot, like what are some of the first things you're looking at in terms of branding and messaging and channels and, how you're going to deploy that?
Yeah, so for the company itself, we're taking a strong bent on a variety of sort of non-traditional marketing strategies and tactics. So we're going to lean in heavily on content marketing. So if we want to change the market and create a little bit more sophistication around research, well, we have to gently bring them into these concepts, right? So this March is Sleep Awareness Month, and so to help people get there,
Sleep Awareness Month, huh?
Yeah, March.
I didn't even realize that.
Listen, every month
there's a month for everything.
Yeah, exactly. We're going to launch a series of articles that show sleep from a very different perspective, right? People think about sleep, even if you're an expert, you'll think about sleep in terms of like neurological status, maybe your heart rate, your body temperature, and your activity, right? That's sleep. And so most things, either in the medical field or the health and wellness field, they orient around those things as ways to measure sleep or improve sleep, right? Everything from ChiliPad to Oura Ring to Lunesta, right? They're all oriented around those neurology, temperature, activity, that sort of thing. So we're going to launch a bit of content that ties sleep in with audio signals, right? You don't really think about, outside of snoring maybe, you don't really think about, well, how can I measure sleep wellness or symptoms or disturbances of sleep with sound? I'm not saying sound is the be all end all, but helping people just think about sleep in a different way, using real data to get sort of the juices flowing and get them sort of thinking about research or thinking about human behavior in research. We're also doing things like, because our platform is designed to help people design and execute research, we also want to work with influencers and people who have interesting products to help them test that in a bit more rigorous way. Like, I think we're all sick of the 4 out of 5 dentists recommend blah, 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 right? That doesn't mean anything to anyone anymore.
Right.
Nor does this is America's favorite so-and-so. That's old stuff. It's for boomers, right?
Mm-hmm.
People today who want to do better.
Cheerios help you lower your cholesterol,
Well, the FDA cracked down on them because they said certain things that, like, hey, you didn't prove that. You need to have evidence. So people with products that want to say something and make a claim, those claims have to be substantiated. So this isn't just about maybe doing the right thing or increasing confidence. Like, the FDA will come down on you and say, you don't have any data to support this, so you better get it. Now, most companies don't have research divisions. Many small companies don't have ways to, afford research. So our company, ProofPilot, is purpose-built to make research accessible, not just to participants, but people who want to do the research. And that's really what we're excited about.
Give us a more specific example of how that works. And again, part of the other reason, I was so interested in having you and interviewing is that side of it, because I'm just selfishly interested in learning about this because I consume a lot of health and wellness products, right? Like, I take a lion's mane supplement every single day. I take ashwagandha, I take creatine, I take, L-glutamine and all these things. And, it's important for consumers to also learn what's true, valuable research and what isn't. And on the other side, I know there's many number of listeners who sell and market to very complex industries in the way that you do, and definitely want that kind of guidance from you. So first off, my first question is, walk us through that process a little bit of ProofPilot. Like, how does it actually, give us step-by-step on how that works. Give us some examples.
Sure. So maybe the easiest way to think about it is like a platform like Shopify, right? So you want to sell a product and use e-commerce as your way to sell it. You can hire somebody to build you a bunch of fancy things and, like, intake orders and blah, blah, blah. Or you can get a subscription to Shopify. And I'm not selling Shopify. It's a really good example, though, of like a product that enables somebody to do something that they probably couldn't do 10 years ago because it was too expensive. But Shopify, you don't just go in there and, like, boom, you have a storefront online. There's a lot of configuration you got to do. It's all self-serve, and you have to do it. So there's a little bit of a learning curve there. ProofPilot works in a similar way. We give you some training. So if you have an idea for your product that you want to test, or a service or behavior, right? This could be some 30-day challenge. We would work with you to help you configure that research experience, right, in the tool, and then you can then promote it to your audience however you'd like to. And we run all of our research through an ethics review, so we make sure that it's done responsibly and you're not putting people in harm's way. And we use consent forms there. So some of this is medical grade behaviors. To make sure you're doing this properly. You're not going to hurt people, and people will know what they're getting into. And then it becomes an experience either on their desktop or a mobile phone, or if you want a retail experience too, you can direct them to the nearest retail location to do something. Essentially, the platform helps orchestrate all the activities you require of your customer in order to test your product or behavior in a systematic way, right? And so then all the data that's being generated by these behaviors and tasks and activities, that comes into the platform. And then you can crunch those numbers to say, oh, I see, there was a general improvement from day 1 to day 17 on this test, whether it's like a glucose test or a creatine test or weight loss or the number of spots on your face. However you want to create your endpoint is the way you would design the study. So we'd help you and advise you. It's ultimately up to you to do and work on the platform, which is why it's so affordable, right? Because to do this kind of research without ProofPilot, you need to hire a bunch of medical writers and project managers and maybe a physician and or a PhD, and it can get very expensive, and it takes a long time.
You're streamlining a lot of that, but giving the same end result.
That's right. Exactly.
And then you're also sourcing participants as part of the platform, or?
We don't source the participants. We can connect you with partners who do. If you are selling a product yourself, you don't need help with that. Actually, you go on Instagram and list the study as an opportunity, or however you sell your channels, or use your email database that way to solicit a response. But it's kind of like driving a car, right? So if you driving a car is pretty easy now. It's like second nature. But the day you got in the car when you were like 16, it's death defying, right? You're kind of scared. So I'm not going to lie, it's going to take a little bit of practice and getting used to, but once you do it a couple times, it becomes very easy, just like driving a car.
So you're using this term that you coined. You need to trademark this and write a book on it, is the research marketing. Are you leveraging this research marketing philosophy for yourself to obtain new clients for ProofPilot, or you're doing this also for clients, research marketing, which is it a little both, or?
Yeah, good. Yeah, we got to eat our own dog food, right? So we're absolutely doing our own research marketing and working with other kinds of influencers to do research there as well, and using our research as a way to get more customers. Because once they see what they can start to do, there's value here that people didn't think they could have access to. So we use research as the way to market our research.
Right. So talk about that. What are the specific steps if you were to write a roadmap out for another, marketer? What is the research marketing method?
Yeah. So it's still
and I think I just wrote your book title for you too. The research marketing method. Boom.
You might be. Well, first you really need to understand, what is it you want to do or say about your product? Are you trying to have a little fun with it and help people learn? Are you trying to generate sales for a customer who might be a little skeptical? So there's like 100 questions. Are you trying to see if there's an aspect of your product that you haven't yet tested and you want to see if you can make a claim? Do you see another product that is competing with you and you think you're slightly better on this one dimension than your competitor, right? So it always goes back to your business objective, right? Which is all what marketing really is. And based on that business objective, you can design the right kind of research in order to meet that goal, right? If your goal is to publish something in nature.com or New England Journal of Medicine, we're going to take you down a very different path of a research type. If your goal is to just learn a little bit more about the difference your product performs in a different age group, right? Using more rigorous data than survey data or like an anecdote or a review, that's a different kind of research you can use. But given that you're typically researching your product, you can use that research opportunity as your sales channel, if you know what I mean. So it's not just like, you can say, hey, sign up for this research. Here's the cost of the product, and come join us. And people, believe it or not, are more than happy to do that. In fact, you'll find people who would rather pay for your product and be in the research than just pay for the product and not be allowed in the research. So we recently did something
as in customers.
Yeah.
Your potential clients. Like talk in terms of the B2B world versus I'm a customer who wants to maybe buy a off-the-shelf product. How does this apply in the B2B sales arena?
Yeah, so I'll do first direct to customer and then B2B. So we just did a study with Dr. Mark Hyman. He's a well-known
sounds familiar.
Food as medicine guru, basically. Great Instagram. He's always talking about food and gut health. He's working on a new He's
I know
working on a
Mark.
new
I've actually read some of
supplement.
his work.
Yeah, great guy, great guy. And we launched a study with him, and it enrolled in about 45 minutes. That's pretty cool, right? For a product that's like still in the works, so to speak. That's an amazing feat. Like if you were going to try and quote unquote sell that product just by selling it, it probably wouldn't do as well. But if as part of a research opportunity, it becomes very different, right? So that's both kind of like a B2C example, but it's a B2B play too, because we approached Dr. Mark Hyman and said, hey, let's help you do this together. Let's use research here as a way for you to achieve your goals. And it gets us a little bit more visibility because we helped Dr. Mark Hyman with that specific study.
That's a celebrity brand to kind of utilize in your arena. Did you guys identify like, okay, he's releasing a new product, and so we're gonna go offer him a free or like an at cost approach to doing X, Y, and Z with it?
Yeah. There's a whole list of really high level influencers out there, right? David Asprey, Mark Hyman, Nutrivore. Justin Mares. There's so many really Glucose Goddess. She does a lot of research herself. So there's a lot of really good people out there with great ideas, and maybe just don't have the time, energy, money, staff to do research. So yeah, we approach them directly in a B2B way, trying to help them think about research as a new marketing channel themselves. And it's gaining a lot of steam. For sure. People, like I said, there's a spectrum of interventions, some that are maybe questionable, but others that your doctor should already be prescribing. And so that whole world is essentially a potential customer. And more than that, anyone who's trying to help somebody with a method or a product or a device, right? And if you want to help that person use your product systematically, ProofPilot is a great way to help them do that, achieve that goal, and not only that, generate evidence for you and the participant, which is
credibility.
Credibility for sure.
Yeah, because some of us know. I'm sorry. Go ahead.
Well, I was just going to say, like, remember that whole trust factor is looming, right? People need a better sense of trust because they already mistrust a lot of things, and that's really what you're coming back to.
Yeah, and again, I love this topic. Like I was diagnosed as celiac back in, my like when I was 18, horrible, like I almost died. And none of the modern medicine methods were working. And I went to, like more homeopathic traditional medicine and like turned myself around relatively quickly compared to the years of pain and agony that I was going through. And, with an autoimmune disease and stuff like that, there's like a lot of us intuitively know of ways to fix it, like things we knew way back in the day and in the 1900s, 1800s, our ancestors knew about these methods. But because they're not research backed in the way that ProofPilot can help out with, a lot of potential candidates for those treatment paths have just tuned them out because the research isn't there. So this is literally saving lives and making sure that the homeopathic is catching up with modern medicine in terms of research, mainly because it's too expensive to go through it and do all the clinical trials and yada, yada, yada. So.
Yeah. And, you brought up a good point. It's not just the people who want to get that trust, but other medical professionals, right? They will often poo-poo something that probably works because there's no evidence. And, in their defense, they can't, in good faith, recommend something that doesn't have some evidence behind it. So, I don't blame them to some degree. But so it's all interconnected. And the more we can generate good evidence for all good ideas, the more people will trust them, whether you're a doctor or a layperson.
So I'll give you an example. Our business, Active Blogs, we write our clients, technical blogs, newsletters. We do their LinkedIn content for very technical industries. How can I implement a research marketing method into, my approach to maybe looking at getting new customers?
Yeah, that's an interesting question. So I like to boil down things really simply. To the extent that what you're doing is trying to teach people, and by teaching them to do something means they should be doing things in a certain way, right? You can create that into a research experience, right? So let's say here are the 5 things you need to do in order to increase your audience by tenfold, right? So your outcome now, your efficacy measure is a tenfold increase in viewership or whatever it is, or LinkedIn, whatever. And your belief is that if you do these things in that order, or with this time dependency, you can achieve that. So instead of just writing out that list, you create an experience where it says, on Monday, do this, on Thursday, do that. Wait 2 weeks, right? And what will happen is ProofPilot can create an experience where it prompts you to do things. It can connect digitally to certain third-party, technologies and apps. It will collect certain data that you want it to collect, or you can enter that in. And it'll start to organize all that evidence in a way that you can then look at it and say, oh, this is right. I can attribute everything back to, this process. Or you can do what we call a randomized controlled trial. So you have 2 arms. You have one person doing, your method, and then on the side you don't do any, separately you don't do anything, right? You just use your own behaviors, and then you can compare those sorts of things, head to head. So anything can be tested in a certain way depending on what you're trying to do. Again, if you're going to publish in a scientific journal, that might look a little bit different versus trying to sell more books or increase viewership of something.
Or I see a potential client I want to work with, instead of doing kind of what a lot of salespeople do and giving them a pitch or something, I can maybe approach it more in a scientific manner. Is like, hey, I noticed you guys are doing this. Like, I'd be really interested. We do this for clients, but I'd be interested in testing this, with you to kind of see what would happen, the experience, or would you guys maybe make these tweaks that I'm seeing you're not implementing? And it's like a consultative but an experimental way, and like you said, creates more of an experience that could lead to a sale for us versus kind of the traditional sales funnel path.
Yeah, or you can, depending on the kind of research you're doing, and if it's a behavior or a product or a method, you can create transactional touch points in there where, hey, this is costing something, so you can share the revenue or the cost of that. So it becomes, everyone has a little bit more skin in the game. So it's just not one person bearing all of the burden of the cost. And certainly, if there is revenue to be generated, the fair thing to do, like with any sales channel, is you find out the right revenue share for that model. Now, this would be for more like consumer focused things. Certainly for an experimental drug, that's a different story.
Absolutely. Yeah. So you mentioned content. A lot of marketers are very focused on content this year. How are you going about sourcing? Because getting content done in your particular business, you got to be very careful, because the people who are looking at it are Dr. Hyman, who's going to call out some BS if he sees it. And maybe even other scientists and whatnot. So how are you going about the content creation process for ProofPilot, for a company like that?
Yeah, for our own marketing content, outside of like creating content that's related to research we're doing with an influencer, let's say, like I mentioned earlier, for Sleep Awareness Month, the content we're creating specifically are audio recordings of people sort of snoring, tossing and turning, scratching at night. So these are things that people have never seen or really heard before. And so that to me is unique enough. And then you have to sort of frame the content in the right way and say, hey, this is a new way to look at sleep. Here are some truths medically. Here's what the market's doing medically and from a health and wellness standpoint. Here's what it sounds like. So it's really just you really have to teach people something. So what we can't do is go in and just like brag about ourselves, but our voice is really going to always be oriented around evidence and research and having people think differently about those topics. in ways that are unique, right? So just for Black History Month, what we did was, a lot of people like to post selfies of themselves saying, I'm all for racial justice, and that's their content play, which is whatever. It's great, fine, but that's not really doing anything. So what we had just done for Black History Month is we tapped into a local community of Black artists and had them pick their favorite Black scientist or researcher and create a visual illustration or design them. And we use that to say, hey, this is our launch of Black History Month and racial equity in research. And we're not doing it. We have Black folks talking about other Black folks and amplifying that in a completely different way, right? Because lots of times people will just throw up a picture of someone who's long and dead, but important, and maybe has contributed to science and research or some topic, and they just sort of talk about them. Well, did you really create opportunity for anyone? Not really. But in our case, we created opportunity for these artists. We connected people on the subject of science in a very different way, in an artistic way, which we thought was really cool. And actually, I saw on LinkedIn the artist and the subject of the artist. These two women connected on LinkedIn, and now one of them's going to speak at the other one's conference, right?
Wow.
So, right, that's opportunity.
That's
that was
amazing.
created.
Yeah.
That,
and you have to share some of those with me so I can share those out. But I love approaching content marketing in that sense. It's a 360 win for everybody. You guys are getting great material to, at the end of the day, promote your business, right? But also create opportunity. And they're getting opportunity, they're getting invested into to deploy this, versus if you guys just went to like some random graphic designer site or someone say, hey, we want drawings of these famous, an agency that, it's different. These are like in the community that you're creating impact, and then it's just a 360 win. So I love that. In winding down here, Joseph, what are any other key takeaways, strategies? We're talking to other B2B marketers here and business development leaders. Anything else that you think is super pertinent that you want to share just in wrapping up?
Yeah, I think for one thing that I've learned in my short time in this role that I don't see, that I quickly forget, and I don't see a lot of in the marketing world in general, and as a consumer, I see it, is to really focus on, don't fall in love with your service or your product or what it can do. You need to really fall in love with the customer's problem, right? So I have this really quick way of trying to hammer that home. And it's about hammers. So it's the old saying of, I don't know if it's old, but there's a saying that says, nobody wants to buy a hammer, right? And what that means is people don't go to the hardware store to look for a hammer, even though they're looking for a hammer, right? What are they really trying to do? They're trying to put a nail in the wall so they can hang a picture. Or they're really just trying to hang pictures? No. What are they trying to? They're trying to make their home a place that feels good, right? That's what they want to do. And so to the extent that all of us marketers can focus on that as the value, right? How do you help a homeowner make their place loving and beautiful and homey? That's what we need to always focus on, not how great this freaking hammer is. You know what I mean? It's not about the hammer. So things that I need to continue to be disciplined about is forget about how good our product is. What am I doing to help our customer get value? And a lot of times what we're trying to do is help that customer increase their trustworthiness, right? Everybody wants to be trusted. Nobody wants to have their product look like snake oil. So to the extent we can help people, help business owners create trustworthy products, that's how we're trying to orient everything.
I like it. I think that's a great note. And ProofPilot too, I saw you guys just recently went through a round of funding. Are you doing more fundraising? Like, how else could people look at getting involved with ProofPilot?
Well, definitely check out the website. We're actually focusing on both health and wellness and life science. It's all important. There's going to be some news about our funding coming out very soon. We've had to actually stop people because we don't want to take on too much, honestly, for a lot of sort of financial reasons. Plus, we don't need it. We're a software company, and if we grow to be 500, 1,000 people, well, we got the plot wrong, right? That's not a software company. That's a service company, at least in the early days. So if we need to ever grow that much and need to raise a lot of money, it's going to be because we've expanded greatly into different kinds of verticals, and it's not going to be around pure service as a linear growth strategy.
Mm-hmm. And best
so just
way,
stay tuned.
Yeah. Well, and LinkedIn kind of gives it away. Like they plaster right there that you guys went through a round of funding. So I don't. Some companies probably don't want that on their pages. I don't know. Some do. I guess it's attractive to investors who are looking at maybe jumping in on board with you.
Yeah, I think it does a couple things, but sometimes too much of it will make your eyes roll, right? So when I see people have gotten like way too much funding, I'm like, why do you actually need that much?
$100 million, like $50 million. I mean, I've seen some crazy stuff. It's like we're interesting world we live in, but the true ones that are actually cash flowing, building great customer base, like you guys. I mean, as soon as you said Dr. Hyman, like I know who that is. Like that would make me interested in following you further, reading your content, and all that. So, I can't thank you enough for sharing with me and today and being here. What is the best way for people to find you, follow you, get into contact with you?
Yeah, just find me on LinkedIn. I'm there, easily found. Joseph Kim. There's a lot of other Joseph Kims, believe it or not, and I'm one of the worst ones out there. All the other Joseph Kims that I've seen are like way more accomplished than me. So look for the one who's least accomplished, and that's me. But
he's being humble, folks. Go look at his LinkedIn profile, okay?
Our website's a great place to and there's always going to be new content and something cool there. So. Unlike a lot of websites that just stay the same, every month it's going to be looking kind of different. And there'll be some very interesting things to learn and read about for sure, and watch.
I dig it. Yeah, if you guys are like me and you just kind of nerd out about that as well, is it of course the marketing and the business growth side, but just this world in general has always been very fascinating to me. So it's very cool to get a little peek behind the curtain from time to time. So guys, make sure you follow Joseph. Joseph, stick around one quick second here while we wrap up. And all of you, if you enjoyed that as much as I did, which I hope you did, make sure you share, make sure you like, make sure you comment. We see you. We appreciate you much. Super grateful to have you checking out the podcast. And got crazy itch in my head. Make sure you go and find the podcast on all your favorite apps. And with that, my friends, much love to you. Make it great. Check out our live events, activeblogs.com/live event. If you'd like the chance to mentor, get to know marketers like Joseph and business celebrities and marketing executives, I'll do it for you for free, but you got to take the action. Come to activeblogs.com/live event. Check out our B2B Mentors free marketing mastermind, and I'll see you guys on the other side.
Yeah.